The following episode contains disturbing accounts of medical trauma, death from denied healthcare, and content that may be emotionally challenging. What you're about to hear are real stories from real Americans. Listener discretion is advised. Your daughter's life-saving hospital stay has been deemed medically unnecessary. That's what the denial letter said. It was addressed to a 4-year-old girl who had just fought for her life in the NICU with RSV. This is American healthcare in 2024. From TalkaCast Studios, this is Delay, Deny, Depose. I'm Johnny Lama. Today we share the stories that emerged after Brian Thompson's death. Stories of a healthcare system where algorithms decide who lives and who dies. The statistics tell a devastating story. UnitedHealthcare denies approximately 1 in 3 claims, twice the industry average. For post-acute care, their denial rate jumped from 10.9% to 22.7% after implementing their AI system. Under CEO Brian Thompson's leadership, UnitedHealthcare's profits rose to $16 billion in 2023. His salary, $10.2 million. UnitedHealthcare's investors remain taken care of, but what about the patients? Like the 4-year-old girl who tested positive for RSV. After fighting for her life in the NICU, her parents receive a letter. The stay was deemed medically unnecessary. Natalie Ellsberg battled a similar denial.
Remembering the day UnitedHealthcare denied a one-night hospital stay for my 12-year-old child as medically unnecessary following ASD heart repair surgery.
Kendall Brown recalls,
I remember walking into the cancer center for my next treatment. The nurses had to tell me UnitedHealthcare had suddenly stopped paying for my chemotherapy. They hadn't even bothered to tell me.
Wendell Potter, a former Cigna executive, said that refusing payment for medical care has become a staple of their business model. They know customers appeal less than 1% of denials. That's money left on the table that the insurers keep.
I lost my uncle because UnitedHealth denied him the procedural surgery he needed for a pancreatic hernia. He was a policyholder for 22 years.
I had my gallbladder removed after 6 months of severe pain. They charged me $6,000 because they classified it as an elective procedure.
One mother's daughter was battling severe opioid addiction in Staten Island. When she begged for inpatient treatment, the insurance agent told her, well, if she dies, you can remove her from your coverage. She can switch to Medicaid. According to the American Medical Association, 94% of physicians report that these denials delayed care. 78% say patients sometimes abandon treatment entirely. A diabetic patient needs insulin to live. The insurance company deems it not medically necessary. A cancer patient needs a PET scan. Denied. He dies 6 months later at age 51. The Commonwealth Fund found that 45% of insured working-age adults were charged for services they believed should have been covered. Less than half challenged these denials. ICU physician Dr. O'Reilly claimed that, quote, the worst part wasn't the money, it was that the denial letters made no sense. Pages of gobbledygook, end quote. Another physician remembers the day he lost his patient.
I had a patient who needed cardiac catheterization. Despite our efforts to secure approval, he had a heart attack and died before it could be authorized.
Under Thompson's leadership, UnitedHealthcare's profits rose to $16 billion in 2023. His salary, $10.2 million. Meanwhile, only 0.1% of patients appeal denied claims.
I'm truly afraid I'll die in this fight for care. I've been to the ER 4 times, the psych ward twice, and participated in tons of groups, but I can't have any continuous care from a therapist. I just get over-medicated and then tossed to someone else.
Thousands of Americans who are being denied coverage are taking to the one place they can actually be heard: social media. We're seeing a pattern here. According to Detective Joe Kenny, people pushed to the brink by a system that seems designed to exhaust them into giving up. As this investigation continues, one question remains. In a system where algorithms make life and death decisions, Where do we draw the line between profit and human life? Next time on Delay, Deny, Depose. As public outrage grows, healthcare executives across America increase security, and a question emerges. Was Mangione working alone?